Hey, family, it's Denise Hill. Listen, I've been transparent about my challenges with depression. I've done that so that others who are challenged can be inspired and informed so that they too can have victory over depression. I got together a number of voices in an interview series for you. I've gotten psychiatrists, psychologists, therapists, counselors, even holistic health practitioners so that they can give you multiple perspectives about this thing and give you more information and tools that you can use on your journey of mental health. Make sure you take notes and, of course, make sure you stay encouraged because you too can have victory over depression.
I'm here with Dr. Flip Clay. How are you?
Man, I'm glad to be alive.
I never know whether to call you Dr. Flip, Dr. Clay, Dr. William, how do you want to be addressed?
Let's just go with Dr. Flip for today, for this particular show.
Dr. Flip, I'll take it. And can you tell everybody who you are and what you do?
I'm a licensed professional school counselor. This is my 19th year. I've been on a speaking circuit for about 16 years, looking at mental health from the African-American male perspective, from young males, from young boys, all the way up to grown men. And I've lectured and presented workshops on topics relating to mental health in the Black and Brown community.
Now, I really want to focus on men. However, I want to pause that for just a second. And I want to talk to you about your work as a school counselor. I spoke with some licensed and certified counselors in the past concerning depression, and they worked from the agency perspective and could not really identify the difference between how mental health is addressed through agencies, meaning you're going to see a therapist or a doctor or someone who deals with mental health versus school counselors who they, believe is, help you get into college and find your way in life. And that's it. So can you talk about school counselors from a mental health perspective and kind of what you offer our children?
I think from a school counselor's perspective, when we look at the word counseling and base it on the school system, you're looking at short-term counseling strategies. So whereas if you go see a counselor or a therapist on the outside, it could be 2 to 3 months. Whereas when we're looking at it from the school perspective, it probably could be 4 to 6 weeks, and that probably could be individual or group. Now, some counselors they have more flexibility, like myself, where I run a lot of groups that might be 4 months. I might run it for 4 months, or my individual sessions might be 12 weeks. But I'm so committed to seeing the transformation. And when you see there's a need today, because 35 million kids walk into a school every day traumatized. So you can imagine out of that 35 million, how many of them are depressed? How many of them dealing with unresolved issues? So not only does the school counselor provide that foundation, but they provide that gateway. So the major difference is your passion and the length, how far you want to go to commit to helping this person heal.
That's good. That's good. So when it comes to mental health in the school system, a child comes to you or you could play any scenario. They're acting out in the classroom. The system says that's a disciplinary issue and they send them to the resource counselor for however many of those are still available. But the ones that come to you, how do you address those issues? What are some strategies that you apply? And even what strategies can you send a parent home with to continue to support that child?
Well, one of the things I talk about when I'm working with students within the school system sector, and even outside in the private sector, I think we focus in on the 4 T's. Transfer your trauma with truth and transparency. Because see, sometimes kids don't even know they're dealing with trauma. So when we talk about the 4 T's, and one thing that really helps me as a school counselor when I go in to talk to the students to introduce myself, I don't talk about counseling, I talk about my story. I transfer my trauma with truth and transparency. This allows them to feel the same way when they come talk to the school counselor. Because if you're genuine and you're truthful about your past and the things you had to overcome in life, children will feel more comfortable to walk right into the room and start talking about your story, and they correlate your story with their story.
So share your story with us.
Grew up, both of my parents, grew up with both of my parents, and I turned 5. We lived in a 4-bedroom, 2-level house, 2 cars. My father had a good job, wonderful, everything. And if you're looking at my life from the outside, everything was wonderful. But within my house, there was chaos, there was trauma. My father was constantly abusing my mother. When I was 5, my father started physically abusing my mother. When I turned 7, the physical, verbal abuse, it just enhanced. He came in one night drunk and took a phone off the desk and struck her on the side of her face. Rushed her to the emergency room. The doctor walked out and said she would have been blind for the rest of her life. My father would come in intoxicated and rape my mother. She didn't want to have sex with him, and she would yell and scream, tell him to stop. This went on from 5 to the age of 9. Then finally, my mom decided to move away, and we went from a neighborhood to the hood. And there she was diagnosed with Kaposi sarcoma, skin cancer. Wow. When I was 10, she sat me down and told me I have 3 years to live. And she said, promise me 2 things. Never treat a woman like your father treated me, to make some of yourself. Because she saw me experience the trauma that he put her through. She died when I was in the 7th grade, 13. And from the age of 9 until the age of 13, I spent every day taking care of my mother, watching her just disappear.
Wow.
So when you talk about trauma and mental health, have the professional experience, but the personal experience brings more value than the professional.
Wow. Wow. I mean, that's a powerful story. And a lot of people, I've experienced this as a speaker myself. When you share your story, there's those aspiring speakers who are like, well, I don't have anything that traumatic to share, so I can't really connect with anyone. I'm sure you've experienced students who have come to you that have just been down, or they just don't understand what's going on with their emotions, and they just can't get them together, and they don't necessarily have a story that's so traumatic, but they feel like they're carrying something. Like, how do you identify depression in some of the students you've worked with?
Isolation, school setting isolation. They're not active like they usually were before. I said isolation. They stay to themselves. A lot of them, something they're doing now, they put their hoodies on. And a lot of my students, and that's one thing I noticed in the last couple of years, a lot of the students who are depressed, they wear a lot of makeup too, the girls, because they're trying to hide the pain. They're trying to hide from themselves. So they put the makeup on. I had one student tell me, she said, I wear this makeup because I don't like myself.
Wow.
But she was traumatized. She was abused as a child. They put the hoodies on. They go home and they go into their room and they shut the door. And they stay in there all night. They don't communicate with their brothers and sisters. And the parents are just like, whoa, what's really going on? And 9 times, I always share with the parents, pay attention to your children. Something that's simple. Pay close attention, because you see those signs, but they really don't pay attention. They don't put the 2 and 2 together because they're busy working. So I said isolation, to stay to themselves, the hoodie, walking around, and you'd be surprised they walk around with the hoodie on because they don't want nobody to see them. A lot of the girls are wearing makeup just to cover themselves. So those are some of the signs I see with depression within the school system. But then when you look outside the school system, it's a little different, because people are older. Those same children now are adults. So some of the things you see is a little different.
Well, let's talk about that, because you specialize in supporting young men and men in their mental health challenges, journey, to become the man that they can be, to reach their full potential.
Correct.
How does it look different as they begin to progress in age, having experienced trauma in their past? How, for men, let's just talk men right now.
Let's talk about
does this look different? Yeah.
I think when we look at it, when we look at, let's say, Black men in particular, loss of focus, sexual dysfunction, alcoholism, anger, lack of motivation. These are probably six variables that play. These are signs you will notice in a lot of our Black men. So I would say they're very angry. I mean, quick to get angry. Lack of motivation. They're not focused. They feel like everything is just crumbling down on them. They go into isolation. They stay to themselves, but nothing is wrong with me. That's how they perceive. Nothing is wrong with me, but you're exhibiting all these behaviors. But nothing is wrong with me. And women are quick to say to a man, what's wrong? That's something you should never say to a man.
Wait a minute. Talk about that.
A woman should never say to a man what's wrong. Because as a Black man, nothing is wrong with me. Because my ego won't allow me to let go of the pride. So what I share with when I'm presenting workshops, and I was speaking in the women's retreat prior to COVID, again, that was, when you're physically active, and it was about 30 women in the room, 30 women. And I said, well, why do you women keep saying what's wrong to us? Because we're going to tell you nothing's wrong with us. Well, what should we say, Dr. Clay? I said, ask me who hurt me. Why would you say that? Because when you ask me who hurt me, it shows that you care. It shows compassion. And I'm more open to think about who hurt me. And am I ready to release that information to you? But when you say what's wrong, I'm bold. My ego won't allow me to let go because of pride. And there's pride before the fall. So when you say who hurt me, that shows compassion. That shows you really care about me. You want to know what's the best, what's going, you really, that's showing me you care versus what's wrong. Because I'm gonna tell you nothing's wrong with me because that's weakness. And as a man, I'm supposed to take the lead. So if I tell you what's wrong, I'm not taking the lead. I'm showing my weakness. So I always tell women, who hurt you? Who hurt you? Because I always, this is what I say about Black men, all of us are constipated. We all dealing with issues from childhood. We are, a constipated man is a dressed up piece of mess. And a man who's dealing with depression is a dressed up piece of mess. A man who won't deal with depression is a dressed up piece of mess. So when a woman says, what's wrong? It allows me to self-reflect. And then when I'm comfortable, I will release that. I will release what's wrong with me and what's bothering me to her. So my nugget to you, to the audience, who hurt you?
Who hurt you? Wow. That's an interesting strategy.
Yeah. Because again, if you say the word mental health or counseling to a Black man, he gonna shut you down. Because nothing's wrong with me. But when you say,
I don't need to tell nobody my business. That's what I hear.
Right. Because nothing's wrong. I'm good. In the barbershop, I'm good. No, you're not. No, you're not. You're not good. Because if you're a Black man in America, we're all a dressed up piece of mess because we're dealing with racism, classism, sexism. We're dealing with all the isms. And every day we have to go to a job and come back in our house. And the first thing the wife gonna say, what's wrong? And I'm gonna say nothing wrong.
Which keeps you backed up. Continuing to pile on the trauma.
Constipated.
Wow.
And one thing I learned looking at it from the school system perspective in the private sector, that you ask the question, about 8 years ago, I started looking at how can I get young Black boys to start talking about depression, suicidal thoughts, anger, the stuff that's been building up in them. So I came up with this radical strategy, and I call it emotional psychological incarceration. It's a non-diagnostic disorder. And the Spirit gave me this visual. And I started utilizing a toilet in my group sessions and looking at the toilet from the perspective of releasing emotional waste and how you feel when you release physical waste. How do you feel? And I would always ask the young boys, I show them a toilet, and then I would say, well, why do people sit on the toilet? They giggle, they fun. And what comes out? They crazy, so they're gonna say something crazy. I said, but how does it feel when it comes? And they said, good. I said, now what happens if you don't release it? You're not gonna feel good, Dr. Clay. I said, but when you release it, how you want to feel? They said, I feel good. I'm going to feel better. Right, right. And I said, sometimes you have to strain. And they giggling, they laughing. And I said, sometimes somebody in your house might go to the bathroom, and when they come out, the room don't be smelling what smell good, and they start laughing. So then I transitioned from the physical waste to the emotional waste. And that's when the green light popped on. Boom. Because they correlate physical waste with emotional waste. So then I say to them, what occurred in your life that you've never talked about? And if you release it, you're going to feel better. Boom. That's it. And I've done sessions with grown men, 300 men in the room, men that walked up to me crying afterwards because of that same analogy, because it went back to their childhood, that adverse child experience that they never dealt with, that causes depression, that causes suicidal ideologies, these thoughts in your mind. It caused you to remain emotionally constipated and emotionally incarcerated. But that analogy, you can't argue with the analogy because it works. I have data to show it works. I've done presentation workshops and I've had young men, grown men come up crying after the presentation because that analogy, like, whoa, I never thought about it. So when we look at depression in Black men, I think that's a strategy that we all can relate to. And it takes away from the ego because it gives you permission to let go.
That was my question right there. So what you gave the question, who hurt you? You gave the analogy, you can identify with releasing physical waste. Now identify with releasing emotional waste. But what has to happen? Who has to give it? What does a man need to see to feel permitted to release, to address the things that he's been piling up for years, in some cases, decades? What needs to happen for him to feel that release so he can begin to deal with things like depression and find wholeness in his life?
I always, when I'm presenting to the brothers, I think because of the male ego, it's the challenge. It's the challenge of someone just transferring their trauma with truth and transparency in front of you, who looks just like you, and they're telling your story. And another strategy I use to answer your question, to answer your question, how so you're basically saying, how do I get them to take that step? That's what you're saying, right?
Well, to anybody who feels like they need, like they want to be the person to help them facilitate that release, but not every man is willing to receive that permission from, like you said, they need to see somebody that looks like them. So that wife could be with them for years and they still won't feel like they can unload, if you will, on that particular woman. So who do they need to hear it from, and how do they need to hear it for them to feel like they have permission?
I think they need to hear it. I always tell men that the enemy is the inner me. The inner me is the enemy. You have to hear it from yourself, but you have to see it. So the analogy I use is when I'm going to stay with the toilet because you can't argue with the concept. So this is a little strategy I use in my presentations, and anybody can use it to answer your question. And it can be done in a small setting or individual setting. Write down the top 10 things that's hindering you from becoming the man you want to become. It could be 5, it could be 10. Write it on a piece of toilet paper.
Toilet paper.
Piece of toilet paper.
Okay.
And whatever you write down, these things are blocking you. I want you to get up, walk into your bathroom, and flush it down the toilet. Because we're going to flush the toxicity out of your life. Because we're visual people. Because once you flush it down the toilet, now you're acknowledging the things that are hindering you. So after that particular step, then I usually provide them with resources. They can reach out and start that healing process. But I think just the challenge of catering to the ego, most men respond to that particular strategy. And that strategy could be utilized by anyone or any individual. So I hope that kind of gave you, how do I get them motivated to take that step?
Yeah.
And it's just something fun and engagement without And another thing I do, I don't use the terms I don't use the term mental health or counseling.
Okay.
I call it a constipated conversation. Because we're all constipated, especially as Black men. So when you say the word constipated conversation, the brick wall will come down. Because we're just talking. But what is mental health? What is therapy? What is psychiatry? It's just people talking. But counseling and mental health, it's no, I don't need it, I'm good.
It has a stigma attached to it.
Right, but if we just having a constipated conversation, we just talking. But we're healing. But it doesn't have that negative connotation to it. Because even when I'm working with young boys, when I say the word counseling and mental health, they look at me like, oh, okay. You would think they won't know, but they've been around someone, they've heard about it, so they like, oh, I'm nothing wrong with me. But what I'm finding with our young youth today, when you ask them what's wrong, they won't say anything. I mean, it's interesting. But when you say, who hurt you? Whoo-hoo, then the eyes get big, especially when you're dealing with boys. Because by nature, we're not going to express our emotions. So when you say what's wrong with me, I'm going to respond like my father, nothing. But when you say who hurt you, that's a whole different story.
I need you to go a bit deeper in that, because it's just so imperative that, I mean, I would love to address depression in young people so they don't become older people who are still carrying the trauma and depression. But like you said, they're watching us and they're learning how to respond to things or to react to things as opposed to respond. They're learning how to do self-care or to not do self-care and just let stuff keep piling up on you. They learn what words are acceptable in our community and in our household. Like you said, they see dad going, nah, no mental health, no counselor. And so they internalize that as something negative. So, what can we as parents do and adults so we can stop traumatizing our kids on top of the trauma that they may already be experiencing through adolescence? We don't want to impose our trauma on them as well. How do we avoid that generationalism, if you will?
I call it intergenerational emotional incarceration. In science, they call it epigenetics. Epigenetics is when the environment loads the gun. I mean, genetic loads the gun, environment pulls the trigger. It's a form of epigenetics, when your environment dictates your behavior. That's a European scientific analogy. Our analogy, I call it intergenerational emotional incarceration. The first thing we have to do as African Americans and Black and brown people is acknowledge that we play a role in creating depression amongst our males.
Oh, wait a minute. Wait a minute. Ooh. Wait a minute. You can't gloss past that one. I know you got a number 2 and a number 3 and a number 4, but you cannot gloss past that one, because we like to point the fingers a lot as a community. They're shooting us, they're racist, they're this, they're that. And you're saying that we play a large role ourselves in perpetuating.
And we don't know we're playing a role. And I'll give you 2 examples. I always ask individuals to talk about the 4 T's. Have you really sat down and discussed your trauma with your children? Number 1. Have you been honest with yourself about your trauma? And number 2, have you been honest with your children about your trauma? Because how do you want your child to be free and to open up and express themselves, but you haven't been transparent. You haven't transformed your trauma with truth and transparency. The second analogy I'm gonna give you is the analogy of slavery. You have the mother, the father, the sister, and the brother. The slave master destroys the father. You have the mother, the son, and the daughter left. The natural response from the mother is to protect her children. But she's going to protect the boy more than she's going to protect the girl. So the girl becomes independent. The girl goes to college. The girl gets a job. She becomes successful. She gets a job. She purchases a house. The mom has pacified and spoiled the boy so much because of what she saw the slave destroy the father, that she protects the boy. So he don't even know how to be a man because his sister has stepped in and taken the place of the man. She's independent, she's successful, she's furthering her education, she's becoming a woman. The mom is constantly pacifying him. I'll do this, I don't want you, da. And this is epigenetics.
That mindset becomes locked in our DNA.
That's it. Or it's intergenerational emotional incarceration. Because when that young man grows up, he's looking for a woman like his mother. But she's independent. She graduated already. She making her money. And she looking at him like, you don't even know how to be a man. But he wasn't taught how to be a man. So then it's intergenerational emotional incarceration. And that behavior is passed down, passed down. That's why sometimes you see a lot of grandmothers pacifying their grandsons. Mm. And then the mothers are trying to kill him. I want him, he need to be a man. But grandma, no, she's trying to protect him because of what happened during slavery. And the young man is stuck in the middle. And then
let me add another scenario to this, because I have this one particular sister in mind, actually. And she was raised by a single mom who was raised by a single mom. And when she had children with a young man, her mom told that man, just know she don't need no man to be here she could take care of these kids.
Right.
And she's pushed them away, to kind of talk about that independence that you're talking about. And so but of course she has boys herself. So it's back to what you were saying. But I want to make sure that the women understand that I don't want them to feel condemned. How about that?
No, we're not condemning them because
Okay.
my mother raised me before she died. So I commend any woman. I have a strong, when I see a young man disrespecting his mother within the school system or outside the school system, sometimes I lose. Because I know what single mothers are going through. And a lot of our single mothers, they suffered from depression because of the fact that they're single mothers, trying to be the father and the mother at the same time. 3.9% of women will suffer through depression in their life. And one of those variables is being a single mother and trying to raise a family and take care of the parents. So when I say single mothers, my hands off to you. Because I know from a mental health, from a school counselor professional and a mental health professional, what you're dealing with. Because not only are you dealing with their trauma, but you're dealing with your own trauma and trying to be a woman and raise a child.
So how do you, it feels like it's just heavy talking about this, man. I mean, because like it goes so far back. I mean, you went all the way back to being enslaved, and that trauma alone, let alone having to try to survive it. And then that survival mechanism becomes part of our DNA that we acted out in different ways generations later. But I feel like it's like, how do we get out of this web? I mean, you even talked about the being transparent with our kids a lot. And I'm guilty of this myself. A lot of, at the beginning of my depression, I wanted to protect my daughter. I didn't want her to experience what I experienced. So I protected her. My behavior was so that she wouldn't have to experience what I experienced, but I didn't explain to her why and explain that trauma that I experienced to her, because I didn't want to put it in her head that this could happen to her. So I'm thinking I'm doing a good thing. Eventually I became enlightened and learned how to be transparent. But there's a lot of parents, you deal with men, I deal with women. There's a lot of women who don't share because they don't want to put that on their kids. So how can they be transparent so they're not giving their children more trauma without them understanding it? But also not unload on their kids and make that a traumatic experience. That makes sense.
I think, you just have to be real. Stop faking. I mean, kids see enough people faking on social media. Be real. Kids want you to be real. It's real simple. Just be genuine. Just tell it like it is and explain it. Break it down. Why are you faking? Because children and youth are quick to say, you fake, or she fake, or he fake. So if they're gonna say that about their friends, what they're gonna say about their parents? Who exhibiting one behavior in one way, and then when they walk into the school, the parents are acting another way. You fake. And you expect your child to respect you. And then you wonder why your kids don't have no social skills. Because you're fake. You're not genuine, you're not real. Because the child, think about it. As a
you want it. You want it.
Think about it as a professional. When we're dealing with folks, we don't want to be dealing with fake people.
True.
Just show me who you are.
Good, bad, and indifferent. All of it.
Your children want to see it all.
Yeah.
So they can learn from it. Don't never be ashamed of trauma. Because we're going to deal with trauma the rest of our life.
You got to say that again.
Never be ashamed of trauma, because we're going to deal with trauma the rest of our life. And you can't go through your life constipated. Because if you haven't transferred your trauma with truth and transparency with your children, how do you expect them to respond to trauma if the person that they're looking up to isn't modeling the behavior? I'm gonna say that one more time.
Please.
How do you expect your children to respond to trauma if the person they're looking up to is not modeling the behavior of transferring their trauma with truth and transparency?
That's powerful.
And when you get to that point in your mind where when you figure that out, watch. Because that child's going to pass it on to their children.
That's powerful. So by you releasing your emotional trauma, the years of backed up emotional trauma, you are in fact unlocking tools and strategies and the ability for future generations in your bloodline to be able to do the same thing.
Absolutely. And if you look at Black men, if you look at, when I look at emotional psychological incarceration, which is a non-diagnostic disorder, a non-diagnostic, that means it's not in the DSM-4 to DSM-5, the diagnostic, who was founded by Benjamin Rush, who was a racist. And he said Black people's skin was like leprosy. So you're looking at this medical book that was created by someone who didn't like you. And you're trying to learn, and I'm not saying this, the stuff in there doesn't work, but you can't go to the enemy to help the inner me. You need something that you can relate to. So when I look at emotional psychological incarceration, you're not going to see it in a medical book, but we are going to deal with some type of emotional constipation in our life, usually from birth to the age of 14. When you turn 14, if I don't deal with that constipation, my emotions become incarcerated. So when I'm 14 into my adulthood, if I haven't dealt with that trauma as a child, my emotions become incarcerated. When they're constipated, you're stuck. When they come in incarcerated, they're locked. So, and what happens to most Black men? We go into a physical incarceration. The numbers don't lie.
True.
The numbers don't lie. And when you're locked up, you have that aha moment that come to Allah, that come to Buddha, that come to Hindu. You have that aha moment where you realize that childhood trauma is why I'm in here. So
wow,
that's real.
It's very real.
That's because when you locked up in that room, you have no choice but to look back at your childhood, because that's why you in there. Because I didn't talk about it when I was constipated. And I definitely didn't talk about it when I was incarcerated. That's why the 9th grade is the highest failure rate around the country, because I'm leaving constipation and I haven't dealt with that incarceration and I'm academically behind. So I'm walking around angry in high school because of my childhood experience that I've never been taught to deal with and manage. And then when I come to have that moment when I realized this is why. I did a workshop in New Jersey 3 years ago with high school students. Man, after that presentation, the young man just ran up to me and was like, "Thank you, I got it, man. I got it. I said, yeah, let it go. You know, I had the toilet, the whole nine, let it go. You know, I sat on the toilet in front of them. I had them write down their trauma and come dropping in the toilet at the end of the presentation. And I said, what you're dealing with, You're gonna write it on this paper. And then you're gonna come drop it in this toilet at the end of the presentation. And then when you go home, because I had them write down the name of 2 people that they feel comfortable enough opening up to. Teacher, counselor, anybody you want. And I want you to just open up and tell that person that those 1 or 2 things that's been hindering you. But you're gonna drop it in this toilet, and then we're gonna flush it. See, that gave them the visual, they had the auditory, and then they physically did it. Now, how many of them did I reach? I don't never know. But it was the experience. The green light, oh, this is what happened to me. And it's a good feeling when you know if I release something, you're gonna feel good. Like,
Yeah.
I mean, it's a wonderful feeling. Like, you know, when you eat a lot of food and you go in there, you let it out and it feels, boy, you'd be like, whoo.
Okay. All right.
So when you're talking to the kids and you use that analogy and you say, man, what's that one thing inside of you? I had a situation. Yeah. When I say it works, I'm telling you.
I believe it. I got the visual.
No, I'm talking about from the emotional piece. Now,
Yes.
I did this with a group of 16 girls on a group session. My lesson was a little different. It was similar to that. And it wasn't in the school. It was in a private setting. And I used the analogy, and these girls were molestation, incest, rape victims, violence victims. But it was funny because one of the, the kids always follow me on social media. So I used the analogy, but I didn't go deep into it. But one of the girls sent me an email, and she said to me, I'm going to find someone and I'm going to sit on the toilet. And I was like, huh? I had to think about it. I was like, she said, I'm going to find someone to sit on the toilet. I said, okay. I said, and, because I was just blown away that they would post, they sent it to me. I think it was on Instagram. I can't remember what it was. So yeah, that was like in a private message. I'm thinking like, oh, she said, I was in the group session and thank you. I was like, okay. Because you don't really, I guess because they didn't have, I don't know, I can't remember what group it was, but it works.
I think it's safe to assume that anyone who comes to talk to you about their bowel movements have been in one of your workshops. You can just assume that.
right. But it was just interesting, and it's funny, but it works.
Yeah.
And the key is what can we do as individuals to help our men, especially our boys and our men, and us as Black people, Black and brown people? What can we do to help us understand the importance of mental health, to introduce us to counseling, to introduce us to mental health without having that negative connotation attached to it? And that analogy gives us permission to say, it's okay to say, I need some help. It's not a sign of weakness, it's a sign of strength.
Yeah.
When you say to yourself, man, I'm gonna let this go. Because when you let it go, you're gonna feel better. I think Frederick Douglass said it's easier to save a child than to help a grown man. I'm just paraphrasing. Yeah. And what I'm finding, and it's so funny because it's the truth. If we can get these young boys in elementary school and teach them how to deal with that trauma and show them it's okay to release it. Because what I'm finding working in the middle school and lecturing across the country, I'm finding young men they've been carrying this waste for 13 and 14 years.
Yeah.
I had one young man tell me, I was doing a group session. He told me, man, he says, since I was 8, my father would always tell me that I wasn't his child.
Wow.
He was 14. So he'd been carrying this for 6 years. And he said, there was times when I just wanted to kill myself because of what my father was saying to me. And it was his first time ever saying this. He was like, man, I don't talk about this, but you gave me permission to say it, to talk about it. And he said, now I get it. So sometimes, Denise, we plant seeds as parents, educators, people in the community. We plant seeds, and sometimes we'll never see the fruition of those seeds, but we just plant that seed. So when we're talking about unorthodox, crazy strategies. Plant the seed
Yeah.
to help our people. Whatever, I mean, do it. I've never, I can't recall one person who can argue with the concept. You can't argue with it.
You can't.
I mean, it's real. And we're going to sit on the toilet every day, I hope.
I hope so too.
And if you're not, you're going to get sick.
You're going to create a different set of problems. That's
Right.
right.
The
That's right.
disease- the
Emotionally and
disease-
physically.
The dis-ease in you is going to lead to a disease.
Yeah.
And that's what I tell sometimes especially when I'm working with the high school kids, you get to, I said, sometimes things you go through cause a dis-ease. And if you don't release it, it will cause a disease. Like, oh, but because emotional trauma will cause a disease.
Well, that goes to one of the questions that I had about depression. Do you believe depression is a disease? And if so, is there a cure? Can it be cured?
I think, I would say there's a cure for everything. Can it be cured? Yes. When you come to the realization that depression is the inner me, and outside of you is the enemy. So you have to look in that mirror and come to the realization, what's wrong with me? Again, we're going back to the 4 T's. The transfer your trauma or truth for transparency. And I'm gonna give you an example. I had a 14-year-old, he was 16, I think, 16, in and out of so many homes, on medication. And he came to one of my sessions. We came to my first session, and this was pre-COVID. This boy, he had a record. I mean, when I read his file, I was like, whoa. But a long story short, you asked the question about mental health and depression. He was on medication. He attended my first session, and about 16 boys in the room. And he saw a majority of the young men crying, telling their story. I saw him 3 days later, and I asked him, was he coming back to the next meeting? Because granted, he's walking around the school cussing everybody out, because he's been locked up, been in all kind of homes, da. That Monday, he was the first one in the meeting. And he sat there, and he said, I want to speak. He told his story. That was on Monday. I think that Wednesday he was sitting in my office. He said, Dr. Clay, I've been thinking, I don't need this medicine. He said, my problem is I never talked about what was bothering me. Because I didn't know how to talk about it. He said, you showed me that it was okay. And he talked, because he shared with the group when he was 2 years old, his mom was on drugs and she kicked him down the steps.
Wow.
And social service removed him out of the house. And he said from that time period, he was just angry and frustrated. He was just foster home to foster home, foster home. That was the second time he talked about that in 16 years. He went into more detail about it. But he said it was like, he said the burden was just released off of me when I sat in there and watched the young men cry. It gave me permission to cry. So he told his story. So to answer your question, I think and I'm not saying medication does not work, because I'm not a licensed doctor. I don't. But I think everything starts with the inner me. It's the inner me. It was him. See, society told him you need this to feel better. And I'm not saying it does not work. All I'm saying, you have to, it's about the mirror, looking at yourself, being transparent with yourself. Even as a counselor, a consultant, and a speaker, every time I get up and tell my story,
yeah,
it helps me to help them. Because even as a mental health professional, I deal with trauma. So it's just knowing that everything starts with the me. In the Bible, it said the disciples were talking to Yeshua, some people call him Jesus, and they said, where's the kingdom of heaven? He said, the kingdom of heaven is within you. See, all of your answers lie within yourself. And as human beings, when we realize that, and there's nothing wrong with meditation, prayer, going to see a psychiatrist, going to see a psychotherapist, Reiki healing, sound healing, all those different treatments we can use. But the ultimate healing is when you look within yourself and you take that first step to seek that healing. And you acknowledge, I've been traumatized as a child. When you can take that step to acknowledge it, then we can look at the treatment, we can look at the counseling, we can look at the psychotherapy, we can look at meditation, we can look at prayer, we can look at Reiki healing, we can look at sound meditation. There's so many tools out there for healing when it comes to mental health and depression. But the ultimate healing is the first step in the acknowledgement. And for us as Black men, we need something that's fun, cool, courageous, and is non-threatening. So we need something, and that's why we need that toilet. We need that constipated conversation. We just need, because they do it in the barbershop every Saturday. Brothers talk. They just having a conversation. There are a lot of groups around the country that talk about, they have different meetings. And what brothers do, they just come, every brother needs somewhere to go to where he can release. That's real. Even our young people, even women need it. They just need it. We do need it. I mean, it's just real. I can't sit still. I'm sorry, but
it's all right. It's all right.
I get excited. I'm looking all over the place. But because my mind's, when I start talking about this topic, I'm so compassionate about it because we know there's a need for it. When it comes to depression, suicide, mental health, we know there's a need for it. And whatever way we can use to introduce it, whatever way we can use to introduce it to our people, and we know it's going to help them, we just need to roll with it.
Well, I thank you for being so detailed, being so transparent. I thank you for sowing these seeds. Hopefully, everybody got the visual and it affected them so that they would want to move forward. One tool, you list so many tools that people can take advantage of after they've had that awakening and begun the process of release. But one tool is pictured right behind you, your book. Tell us about it.
Oh, the Diary of Emotionally Constipated Man. Within that journey is my personal and professional story. But on top of that, there are case studies that contrast and compare my personal and professional journey. So I'm looking at, from case that I'm looking at, molestation, incest, rape, fatherlessness, and abuse. From my story, I'm looking at my father not being in my life, my mother dying when I was young, watching the physical abuse, watching my father rape her, force her to have sex, and all that trauma that I dealt with. So in my book, that's what, so the diary represents my case studies. The Constipated Man represents my trauma in my life. And I contrast and compare those. I contrast and compare those scenarios. And at the end of each chapter, there's questions to help people self-reflect on each chapter. It's like a workbook.
Yeah.
And there's topics in there from emotional, psychological, intergenerational emotional incarceration, man down, father gone, love, lives, and emotions. Every chapter you can relate to. I must say, when I was writing the book, it was life-changing because I was transferring my trauma with truth and transparency.
Well, you can't help somebody else till you put the mask on you first. So I'm glad that you went through that so others can be enlightened by the information that you shared. Tell everybody how to get it, how to get in touch with you, everything they need to know.
You can go to constipatedman.com. That's pretty much for the, constipatedman.com, boysoffthehook.com. You can contact me 301-529-0450.
Social media.
When they just go to boysoffthehook.com and it'll have all my social media I'm on Instagram, Dr_Flip07, Facebook, Dr. William Flip Clay, Twitter, Dr_Flip.
We gonna stay with boysoffthehook.com.
.com. That's what I'm saying. You know, and everything will pop up. And then you just Google my name, it'll pop up. But yeah, I got that. That's why I just want to say boysoffthehook.com is easy to remember. Constipatedman.com. You can send me an email, shoot me a text, yada, 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 yada. Let's make it work. Let's make it happen.
Absolutely. Dr. Flip Clay, thank you so much.
Man, thank you, Denise. Blue.
Man.